Hello, it's Dr. Adi again. Good afternoon. And following on from the last short where we discussed ectopic pregnancy, I want to discuss a few other things about it. I want you to spread the word because it's not uncommon and it can happen to anybody, like we said. Yes, it's related to previous pelvic operations. It's related to even sterilizations, because you could have an ectopic pregnancy after sterilizations. It's related to endometriosis, where you have scarring in the pelvis, and it's related to pelvic inflammatory disease, previous pelvic inflammatory disease, because of scarring again. So it can happen to anybody. I want you to bear in mind, like we discussed, early pregnancy is sometimes difficult to diagnose because it's ever so early, but the nausea, the reduced appetite, increased appetite, the breast tenderness, breast swelling, and also a positive pregnancy test, which nowadays are quite sensitive. Now, the other thing is, if you have one-sided pelvic pain, please let us know. Very important. The bleeding is not necessarily heavy. It's not like, say, you're having an incomplete or a complete miscarriage. It's not like a miscarriage at all. It's actually quite light bleeding. So bear that in mind. Don't think, oh, because I don't have much bleeding, I can't have an ectopic pregnancy. No, I want you to pass this on also to young people in discussions, because it's not something that is commonly known. They don't have to feel awkward about having activities leading to pregnancy, because sometimes that hinders them from coming. And it's very important that you come forward and actually say it, so that there's no delay in looking at our diagnosis. Because if it's not, we're looking at appendicitis, we're looking at bowel problems, we're not actually looking at a possibility of an ectopic pregnancy. Be transparent in your presentation when you come forward. There is no judgment. We've all been where you are. Even doctors are human beings, believe it or not. So be transparent in your presentation. We do not judge. We do not actually leave the office and think, oh, somebody said, no, we don't. Okay, and it does save lives. Like I was saying in the last short, my first patient, first patient I had as saw as a medical student, actually died on the table because of this lack of transparency. Okay, this helps us a lot in making a diagnosis. Thank you very much. I'm doing this mainly because this is all I can give. Thank you.